Hello, Oak Knoll community. It's Kim Bergen-Jackson. I'm the administrator at Oak Knoll, and I'm recording on Wednesday, March 9th, for your viewing pleasure on Thursday. We are uploading the videos to be viewed on Thursday so they can be edited. So thank you for joining me. 2 years ago today, Wednesday the 9th, we implemented all of our COVID policies because COVID had been detected in Johnson County and the first 3 cases in Iowa, actually. Is it crazy to you? It's crazy to me that we've been talking about coronavirus and COVID-19 for 2 years today. We implemented a bunch of changes overnight. Everybody changed the way we did business, and we took care of business for 2 years. We were very fortunate to avoid an outbreak. I'm forever so proud of everybody and I mean everybody, for all their efforts to keep the virus out of our building. None of our residents and none of our staff were hospitalized for COVID, and of course nobody passed away, which was my biggest fear 2 years ago today. So thank you for all of your efforts and willingness to stand together and win against the virus. COVID is still going down in Johnson County, which is a great relief to me. I got a message yesterday from the University Hospital MICU staff, the medical intensive care unit, to tell me it was the first day that they had no COVID patients in their MICU, and they didn't know what they were going to do with themselves. And so that is very exciting. So hospitalizations are down. Pediatric cases got a little higher than I was comfortable with, and those are going down. And of course the mask mandate was stopped on March 1st in Iowa City. So you are no longer required to wear masks. If you still feel most comfortable wearing a mask, I would encourage you to make the safest choice for yourself. It's all about personal accountability now, and in Oak Knoll, you are no longer required to wear a mask inside the building. Now, if you go to the health center or assisted living, those are licensed areas, and we all know the federal government is a little slower than the state government to make changes. The masks are still required, and so visitors and staff will be wearing masks downstairs. So if you catch me upstairs in my mask, I just forgot to take it off. But I feel very comfortable about us not wearing masks, so don't worry about that. I did mention in my last video that we would be having a vaccine clinic for the 4th shot. However, public health is not offering that 4th shot to everybody yet. They're offering it to people who are immunocompromised. So if you have an autoimmune disease, if you have cancer and you're receiving active treatment, if you have HIV, or if you're taking high-dose corticosteroids like prednisone, then you would be eligible to receive the 4th shot. So I have some vaccine. I have a couple of residents who have told me they have an autoimmune disease. Those people are eligible for the vaccine. Otherwise, I will keep all of your names if you've contacted me on a list, and as soon as it's available to the general public, I will let you know. Right away, we'll hold a clinic. If you can get your physician or your provider to say that you are eligible for the 4th dose, you can go to any of the pharmacies, Walgreens and Hy-Vee, and I believe Towncrest are offering the vaccines. They just need you to attest that you have met the criteria to receive the 4th shot, and they'll give it to you. So I think I would call first to see if they're taking online appointments only, or if you can walk in. But that's my update on the vaccines. We'll start, of course, in the health center and assisted living first once they make it available to the general public, and then we'll have a big clinic, which we can do in our sleep now because we've done quite a few. So events are up and running. Visitation is open. Visitors will be asked to screen in at the desk forever, maybe. I'm not quite sure yet what they're doing, but vaccinated visitors are welcome in our common areas. As of yesterday, Spring Street reopened, and so all of our dining venues are open. The Mixers is open. That's great news. If you love Third on Third food, I would recommend going there for dinner. I'm looking forward to having a pizza. Health-wise, we have no cases of influenza either. I am hearing some rumblings about Candida aureus AURIS. We had just started talking about that. It's a fungal infection. It's spread across the country. It's not a pandemic. It's not anything we need to worry about. We've changed our disinfectants to make sure that we kill it on surfaces. And so I don't want you to worry about it. I just want you to know that I'm always looking at the public health website for influenza cases and now this fungal infection. And so we don't want to get that. So if you have a rash on your skin, you're going to want to have your doctor take a peek at that, see what it is. Don't anybody worry, though. It's not like COVID. It's International Women's Day. Yesterday was International Women's Day, and we are really fortunate to have some real powerhouse women in Oak Knoll, and so I'd like to give a shout out to International Women's Day and thank everyone for all their hard work in their careers. And we have some powerful women staff here too, so thanks to all of our team members. Like I said, it's March. We're moving into spring, I hope. Maybe one more snow day, and then warmer weather is ahead. This weekend, you spring forward, so your clocks will change, which is more daylight for us, which is exciting. So things are looking up in general. I hope to see you in the hallways or in the dining rooms, and I will see you in 2 weeks for a new update. Thank you. Have a great week.